Well, recurrent miscarriage is not an uncommon condition. It is estimated to be affected 1 in 300 pregnancies. In other studies, it has been shown that it might affect up to 1 to 2% of all women in reproductive age. So it's not an uncommon condition. Well, the main cause which explains at least 80 to 85% of the cases is a genetic problem in the products of conception, which is totally randomly formed at the time of conception in the vast majority of the cases, but in a minority of the cases can be explained by one or both the parents being a carrier of a genetic problem. That is why it is strongly recommended in all couple experiencing recurrent miscarriage to have a test, a simple test, which is a blood test called karyotype, which is able to detect whether any of the parents are carrier of a chromosomal condition. Other reasons can be a tendency to form clots, which is blood clots, which is basically genetically determined and is known as thrombophilia. And another known reason is a problem called autoimmunity. So which is characterized by the immune system acting against itself, which normally shouldn't happen. Normally, there should be a tolerance from our immune system to what is self. But sometimes the pregnancy is not tolerated, is not identified as something self, because clearly 50% of the genetic information of a baby are from paternal origin. So sometimes the maternal immune system triggers an immune reaction, unfortunately, against the baby, which causes the miscarriage. And lastly, there are some general health conditions which might determine an increased risk for miscarriage. And again, some autoimmune conditions like diabetes or thyroiditis, rheumatoid arthritis, Crohn's disease. So there is a link between autoimmune conditions and in some cases an increased risk of develop a miscarriage. There are a series of risk factors which we know can increase the risk for the patient to undergo recurrent miscarriage. The most common is having had previous miscarriages, for example, because that means that there might be a reason for that, and it is the job of the specialist in recurrent miscarriage to try to identify this condition through the help of the necessary tests. Then, as I said before, there might be chronic health conditions which might increase this risk as well. And I have already mentioned some of them. in some cases, there is the presence of uterine or cervical uterine problems, which can increase the risk of that. Just to mention some, the presence of fibroids or polyps in the uterus, or a condition called septum of the uterus can also cause that. So uterine malformations can often be a reason for recurrent miscarriage, and they can be easily identified with a scan or a magnetic resonance, and then surgically corrected. Then another factor is clearly smoking, alcohol, use of drugs, which needs to be clearly identified by asking the patient what her habits are, and if the specialist identifies one of these areas, it is strongly recommended that the patient is able to correct that. As I said before, an excessive or even a low body weight can represent a risk of miscarriage. So both conditions, excessive and very low body weight, are to be corrected whenever possible, because are known risk factors for recurrent miscarriages. And lastly, invasive prenatal tests can also be a possible reason for that. They always carry a risk. They are helpful in most of the cases, but the patient needs to be informed that whenever we perform an invasive prenatal test, there is always an associated risk of miscarriage. As I said before, sometimes there are some general health conditions which might be an underlying cause of recurrent miscarriage. That is why it is always good to have a general profile and to run some tests. I'm thinking, for example, at the liver function, thyroid function, the metabolic profile. So all of these things should be always requested, because we might find that the problem might be affecting other areas of the body, and eventually contributing to the risk of developing recurrent miscarriage. Normally, after at least 2 miscarriages, I think the specialist should discuss with the patients what investigations are more appropriate to try to determine the cause of it, because experiencing even 1 miscarriage, not to talk about recurrent miscarriage, is a devastating experience for the couple. So the specialist should do whatever he can to try to identify the possible reason as soon as possible by running some investigations, and to put in place a treatment for that. The good news is that in most of the cases, once the proper reason has been identified, there is an effective treatment we can put in place to increase the chances of our patients to achieve a successful pregnancy.